We're going to have a brief discussion on sick care versus health care versus wellness care. Now, anytime you're trying to communicate an idea in this life with somebody else, you have to have the same concept in your mind, the same conceptualization of an idea. Because if you don't, there's not going to be an understanding between the two people. So if I have a concept in my mind, I need to be able to communicate that clearly to you so that you have the same concept and we're talking about the same thing. Now, one of the most important things in this idea is you need to define your terminology. So this day and age, it's very common for terminology, for words to have their meanings changed or to be referring to other things. And then when we're trying to get a concept and an understanding of something, you're going to find that it's very hard to do because the water has been muddied up so much. So we're talking about health. What is the definition of health? Health is the state of complete physical, mental, and spiritual well-being, and not merely the absence of disease. Health is everything functioning normally. No disease, no sickness, no problems. When I did my research on this and I looked up sickness, the definition of sickness is the state of being ill. That's basically like saying sickness is the state of being sick. So whenever you utilize a word to define a word, you are explaining exactly nothing. So what is sickness? Sickness is basically the lack of health, dis-ease, dysfunction in the body. This body's 100 trillion cells are not all functioning normally. There's some parts of this body that are functioning less than 100%, meaning we're having dysfunction, disharmony, dis-ease in the body. Sickness is basically a lack of health. Try to think about it like this. Darkness is a lack of light. As soon as you turn on the light, darkness goes away. And health is exactly the same. Sickness is basically the lack of health. And as soon as health is present, sickness goes away. So sickness and darkness, they're not entities unto themselves. They are merely the lack of light, the lack of health. Hopefully that's clear to you. As I said earlier, one of the main mistakes that we make is we start to fumble around terminology. For example, health care, health insurance. We all have health insurance. Basically, we have health insurance so that if there's a catastrophic health crisis, sick crisis, we don't end up losing our house. And we have health insurance because the medicalization of healthcare is so expensive that if you ended up in the hospital for a couple of days, you would probably have to sell your house to pay for it. So when you have a crisis with your health, you're not actually healthy. You are sick. So let's call it what it is. This is sick care. It's sickness insurance. You don't ever walk into the emergency room and say, I'm feeling great, check me out, and make sure I stay feeling great, and here's my health insurance card to pay for it all. We never do that. We only show up at the emergency room when there is a crisis with our health. So we must make sure that when we're talking about something very specific, like health, that we are using the terminology correctly. Please don't get me wrong. Medical care is a very necessary part of our social fabric because if anything happens, we can always depend on them in a life-saving event to do their best to keep us alive. But when the house is burning down, the fire trucks come and the firemen come out with axes and hoses to put the fire out. The firemen don't actually do anything to restore that house afterwards. So think about it. If you have a health crisis and you have some breakdown, medical intervention is going to be very important to help maybe put that immediate fire out. But we need the electricians and the plumbers to come and restore the house, and we need other practitioners to come and help us restore health. So we wouldn't expect a firefighter to come back to the house every day and spray the house down with water to keep you healthy. That doesn't make any sense. They are there for health crises. Medical doctors are there for a health crisis. They are not there to restore your health. This day and age, we call healthcare what is really sick care. And I suppose they did that because sick care isn't a very attractive term to use. So they utilized healthcare. And we've used this term so much that people ask, like, what is your medical history? And they're referring to your health history. But what if you don't ever go to medical doctors and you don't have a history of utilizing medicine? Then what are we talking about? What is your medical history is referring to health history. Always utilize the same terms and always be very aware when people are utilizing terminology incorrectly. Over the years, what's happened is we've misused the terminology so much that we actually came up with a new term called wellness. And if you do a search on the internet of the utilization of a word, you can see that the word wellness was never used in society until about the 1970s, and then you see a dramatic uptick in the utilization of the term wellness. So what is wellness? Wellness is the quality or state of being healthy in body and mind, especially as the result of deliberate effort. Now that's the key, is that you're putting in the deliberate effort to maintain health. Furthermore, it's an approach to healthcare that emphasizes the prevention of illness and the prolonging of life, as opposed to emphasizing the treatment of disease. That's so good, we need to review that again. Let's go over it again. Wellness is the quality or state of being healthy in body and in mind, especially as the result of deliberate effort. Furthermore, it's an approach to healthcare that emphasizes the prevention of illness and the prolonging of life, as opposed to emphasizing the treatment of disease. So, what are the things that make up the essential factors of life and of health? You have food, water, oxygen, and nerve supply. If you cut off any one of these things, you are going to die. It might be a matter of moments and it might be a matter of weeks. So we've got food, water, oxygen, and nerve supply. If you remove them, the result is going to be death. But if you interfere with the quality of any one of these, the result is going to be decreased function, decreased health, disharmony, and dis-ease within the body. Now, your body is designed such that if you do absolutely nothing for your health, chances are you're going to be sliding down the ladder. You are somewhere on the ladder between 100% perfect function and 0% function, which we would just call death. If there's 0% function in the body, you're dead. So you're somewhere on this ladder between 100% perfect function, which I don't believe too many people are, and 0% function. So if you're doing absolutely nothing for the quality of your health, nothing preventative whatsoever, the stresses of life are such that you're most likely going to be sliding slowly down this ladder towards dysfunction, disharmony, dis-ease, symptoms, health crisis. If you are putting in the deliberate effort, then you are going to be building yourself up this ladder. Your body's going to be getting stronger. You're going to be adapting to your external environment. You're going to be doing all these different things that maintain you at a very high level of health. And I assume, if you're like me, that that's where you want to be. I don't think there's anybody walking around that wants to be experiencing health crisis, dysfunction, pain, and symptoms throughout the course of their life. We all want to be feeling good, but we need to understand that the feeling good needs to come from us actually functioning well, not just treating and masking symptoms. We want to be correcting causes and functioning normally, and have our feeling good come as a result of us actually functioning correctly. You maintain your house, you maintain your car, and you put time and money into these things, the maintenance of your vehicle and the maintenance of your house. Are you putting the time and the money and the mental energy into maintaining your health and wellness? Make sure you cut out the time to maintain your health and your wellness, and let's know what these terms actually mean.